Any questions? I see one issue in the chat that comes up, and that's timeline. We have a lot of experience with the timelines for doing this. And it also kind of depends on your perspective on timeline. At the annual meeting for OCHIN last week, I reminded folks that actually OpenNotes has been talking to the OCHIN organizations for 5 years, and we've made multiple presentations. We've offered small grants. I think many of you all have had the opt-in, and with one click, folks could have shared buttons. And I realize that the decision the OCHIN board made in the fall, seems like one that you have to get going to work around this anxiety. But I think you've also heard the advantages of the default approach. I think you can see that. I love I think Jen's comment that at New York City Health and Hospitals, this was slow and steady. So the default to opt-out doesn't mean this is going to be a tsunami. It doesn't. This is going to be slow and steady with lots of decisions for each organization to be made. You notice that I think I'm forgetting now. Oh, UW. UW did not tell their patients. They didn't promote this to their patients. And you all are going to have to decide, each of you, to what degree are you going to promote this and encourage patients? So you still do have a lot. I understand the anxiety, though, and if anyone wants to make any comments or about that, step up here, please feel free.
So this is Andrea Strecker again with Rochester Regional Health, and just to echo what John said, so our competitor, the U of R, actually did go opt-in a year before changing their settings to default, and they didn't put as much resources and time into getting people to try changing their settings, but they did communicate about sharing notes, and the amount of notes shared from opt-in versus going default was a complete 180, and default's really the way to go.
Hi, and this is Melinda Fulmer from OCHIN. I'm not sure how many OCHIN members on the webinar today were able to attend Learning Forum, which was last week. This is OCHIN's annual conference. But we also had a member panel which consisted of OCHIN members who were early adopters or who piloted shared notes. And the one thing I can tell you is, out of all these groups, they were able to accomplish in the same time frame with their pilots going live by default, the same time frame that we have here for the entire collaborative. And one of the things that all of the presenters, we had Monterey, Winding Waters, and Bastyr University, they all said that, by sharing it by default, some clinicians indicated, well, I will just unclick to exclude a note. But as they saw all their colleagues around them sharing notes, hearing the benefits, and not experiencing any problems, that convinced those who were sort of against the idea of sharing notes that this is the way to go. So again, we have experience within OCHIN, within members with the same patient population that you have, that have had great success with that.
Thank you, Melinda. Others? Okay. Well, let me wrap up. OpenNotes is very interested in doing anything with any of you to help this process along. You can email me, santa1177@comcast.net. Go to the website and communicate to us, opennotes.org. Obviously, OCHIN staff know how to reach us and are there to help. I know that our executive director Kate DeRoche is giving a talk next week at the Boston Healthcare for the Homeless. I was intrigued when I saw Sarah Jackson's slide because I actually didn't know that they had a clinic, the Pioneer Clinic, which she mentioned, which focuses on the homeless. As you know, she mentioned the uptake there of reading notes has been slow, but there's an organization who's focusing on the homeless, and we really should hook up UW Pioneer Clinic and Boston Healthcare for the Homeless. So lots of opportunities out there. We would love to help, and unless anybody wants to say anything else, we're done. Thank you all so much, and thanks for hanging in there with us.
And John, on behalf of OCHIN Collaborative, we really appreciate the time. And to all the presenters, thank you so much for sharing your initiatives. Again, thank you all so much for your support.
Thank you.
Thank you all.
Bye-bye.
Bye.
Thanks, everybody.